brain health isn't on our agenda, and that's scary from what we've learned today. The fifth leading cause of death for Aboriginal and Torres Strait Islander people, yet we're not doing anything about it.
Dementia is obviously a condition of the brain, of which there's deterioration. The obvious things are usually to do with obviously your memory, and how I loosely explain it to people is we all forget things sometimes. But there's a difference between forgetting where you put your keys as opposed to forgetting that you even own a car. And obviously that, generally speaking, is a condition that affects older people. However, we're seeing that it's displaying in younger populations a lot more frequently.
There seems to be higher rates now of cognitive decline in younger people, and they're very underdiagnosed. We do not have sufficient services in the country to manage cognitive decline, and most importantly, the majority of the reasons Aboriginal people are getting cognitive decline are actually due to modifiable risk factors, things like smoking, smoking cessation, managing obesity, hypertension, high cholesterol, ensuring that heart health is managed, so reducing the burden of atherosclerosis, which can cause vascular dementia.
The current situation is that there, as we've been discussing today, is that there's not a great deal of awareness, education and things like that, particularly with that condition. We know that mob are very resilient, and they typically may present later with the condition rather than earlier.
One of the things that we've learned is that there are a lot of myths, first of all, around what the causes of cognitive decline are in Aboriginal people. There was a big study done in 2002 where people had these assumptions that dementia was caused by things like alcohol, more likely, that it didn't affect Aboriginal people as much because life expectancy was shorter.
Being able to destigmatise dementia in the community and just make sure people can get support is really important.
If we have an elder who's a significant person in community, can their diagnosis and their experience, should it be possibly negative, that can have major impacts to everyone around them, which can then once again encourage people to withdraw.
Dementia is seen as a deficit approach to health and wellbeing for our people, similar to cancer. So the messaging in our community is that we need a softer approach. So with some people we'd spoken to late last year around a possible research project, they talked about dementia and early onset dementia, and we said, no, let's talk about brain health.
We're trying to take the complexity out of the whole system for a community that comes and engages with us, and hopefully we can give a streamlined approach, or like the consistency of workers and faces across their whole process as they get older.